Hello. Lot of people ask me whether root canals are safe. Now, that is when I decided to make this video on the safety of root canals, whether it is safe or not. I'm Dr. Prasanth Pillai. I'm a maxillofacial surgeon by profession, but I'm also very keen to educate my friends and patients on various dental procedures, and this video is being shot as a part of that. Now, I'm sure you would have watched my previous video on the fundamentals of root canals. So now I'm here to tell you about the safety of root canals, whether it is safe or not, what are the dangers of undergoing root canals. A lot of people have got concerns, so I thought it's important that I do this video. So now this slide, this picture out here shows the varied structure of root canals. You can see there are so many ramifications and branchings of the root canal, the pulp of the tooth, and you can never find one root canal similar to another, just as is the case with your two palms. When you compare your two palms, they are different from one another. Okay, so that is the way it is. So it is important that you get the root canal treatment done by an expert. This is what I've got to tell you. There are root canal treatment specialists. They are called endodontists. Endo means inside, dont means tooth. So endodontists are the people who do root canal treatment, who are specialists in root canal. So they are very skilled and they have all the necessary equipment and techniques. They are trained in various techniques in ensuring that your root canal works well. So they are the ones who should ideally do root canals. So once you go to an endodontist, he will approach the problem in a very scientific way and he will identify the issue. He'll remove the pulp completely. Now it's extremely important that the entire pulp chamber is removed, cleaned and filled right from the root tip, so that you don't really leave any void behind. And if you leave voids, that is where the infection develops. So you can see how the structure of the pulp is. Now, in this particular video, you can see this. You can see the way the branchings are there. And it's extremely difficult for a person who's not trained in this to really do a proper root canal. So it's important that you get this done by a good root canal treatment specialist. And you can see this, a single molar tooth out here, which has got two roots, and in this particular root you have two branches, whereas out here the same lower molar in a different individual, you can see two root canals coming out in a different pattern in one root and three root canals in another root. So and here you can see the curvature of the root canal. So there are so many things which you need to look into. And in this particular case, you can see there is a block here because of some kind of calcification. They've been trying to negotiate through into the canal, but there is a block out here, so they are not able to put the file into the root canal. So all these are situations where you end up in failures. That is where you end up in failures. Now you can see this is a clear picture where the root canal seems to have been done right, but you can see there is a portion of the root canal out here which has been left unfilled. Now this is the area where you can have potential for trouble. So I want you to be aware of this. So all these things, now you can see this, a root canal treated tooth which has developed an infection at the base. So all these things happen when you don't get it done at the right time, when you don't get it done by the right people who are trained in doing this. Another reason, a very prominent reason for the failure of a root canal is the fracture of the root canal treated tooth. Very often people vanish into thin air after getting their root canal done just because they are free from pain. But the problem is, as soon as the root canal is done, you remove the pulp and you put in an inert material into the pulp chamber, which is called, very often we use something called gutta percha, which is a resin which is being filled into the pulp. Now, what happens the moment you've removed the live portion of the pulp from within the tooth becomes dead and it becomes brittle. It is more prone to fracture because it resembles an eggshell. So whenever you bite, you're exerting tremendous amount of forces, and the forces act on the brittle tooth structure and the tooth breaks. So this is what happens, as is shown in the slide. The tooth cracks, and finally the tooth fails. The moment there is a crack, then you have the entry of all the bacteria into the filled root canal from the sides, and then another infection happens, and then the root canal treated tooth fails, and then they attribute this failure to a failed root canal, which is not the case. This has happened because of the fracture of the tooth. Okay. Now, there are so many ways of addressing issues. So they use post and core and several other methods to ensure that a fractured root canal treated tooth is treated properly to build up the crown. So I hope I've given you an idea about the possibilities of failure and the reason for failure of root canals. Now, please remember, what can happen if a root canal fails, if a root canal treated tooth fails? There is always a constant focus of infection below the tooth, and this tends to spread sideways and it can affect the adjacent teeth. And this focus of infection can always get into the bloodstream and create problems in the rest of the body, like the heart, the liver, the lungs. When you have a focus of infection in the mouth, this can always spread and create trouble in the rest of the body. So it's not good to walk around with an infected root canal treated tooth, even if it is not painful. If it is infected, please get that corrected. You've got to remove the root canal filling and retreat the root canal. And very often you also have to use lasers. Laser assisted root canal therapy may be needed. And once you use laser assisted root canal therapy, I'm sure you will be able to get the problem rectified. So I hope you liked this video on failures in root canals, and certainly share this video among your friends, and do like our video and also be a subscriber of our channel. Thank you very much. Goodbye.